Welcome, everyone. My name is Catherine Duggan. I'm the Chief Executive Officer here at the International Pharmaceutical Federation, FIP. I'm here today with my co-host, Sandra Carey, the Global President at McCann Health, for the second of 3 fireside chats with global health leaders to get some views from outside our profession. McCann Health has worked with FIP for many years, and since I've joined in June 2018, we've continued and consolidated our collaborations. Over recent months, Sandra and I have had more opportunities than ever to discuss the ways in which we see pharmacy respond and evolve speedily to meet the changing needs of our population during this pandemic. In our discussions, Sandra and I suddenly realised that it was 2 pharmacists discussing pharmacy with an inward view, and that it was time for us to get outside perspectives so that we could explore global leaders in health perspectives and get them to see where the opportunities and challenges and advice for us in pharmacy lie. The focus of our mini-series is to consider the rise and primacy of the pharmacist in the healthcare system. We seek to get these external perspectives, and we'll be probing and prompting our global leaders to tell us what the challenges and the opportunities they are. So a big welcome today to John Cahill, the Chief Executive Officer of McCann Health and a true global leader in healthcare. As the global CEO for McCann Health, John is responsible for leading the world's most connected community of health and wellness experts across 6 continents, and focusing on commitment of more than 1,600 employees on generating life-changing ideas. John, you are a true global citizen. On any given day can be found traveling across the network, spending equal amounts of time in the US, LATAM, EMEA, and APAC, meeting with clients and employees alike. John believes that a strong, consistent culture is essential for a successful global network, and so has focused on creating this in McCann Health. And I look forward to talking with you. Thank you so much, John, for taking the time to be with us today. Sandra, over to you for our first question.
Yeah, and good morning. And good morning, John. It's always great to talk to you. And Catherine, it's always a pleasure to do these. Just in thinking and looking at kind of where pharmacy is going, John, what would you believe to be the biggest challenge in healthcare globally when we think of not even necessarily post-COVID, but what will happen as this pandemic continues to evolve?
I think there's going to be, thanks, Sandra. And look, folks, very, very happy to be here. Thank you for the opportunity. I think there's going to be quite a number of changes that we see, but if I could focus on a few, which I think are very important because I think pharmacy has a role to play in them. I think at the population level, I think we're seeing a massive reduction in what we would call health optimism. There's prevailing confusion in what is authoritative and correct information. Even some of the most trusted sources of information are changing their points of view as we learn more about the pandemic. And this is giving rise to that confusion. And when you see confusion around health decisions and information, you will see a concomitant drop in health optimism. That may then influence things like the effective uptake of a COVID-19 vaccine. And I think we're already seeing in many parts of the world where large percentages of people are expressing what we would call COVID-19 vaccine hesitancy. And then on top of that, while we were having a health crisis and we seem to be making a somewhat bumpy exit from that, we also have a macroeconomic impact ensuing, and you'll see a lot of the economies of the world are impacted by it. So we're looking at recessionary economies on top of a depleted or a stretched health delivery system. How are we going to bolster that system for the future so that we can provide adequate care as we exit COVID-19? And then probably last but not least is pandemic wear out. It can fuel a sense of futility. We are already seeing demonstrations and perhaps people not adhering to the best practice of restrictions. If this goes on much longer, and I think it will into the early part of next year, we might get this pandemic wear out, which will give another acceleration to the reduction in health optimism. That's at the population level. If you look at the individual level, there's no doubt an ensuing tension between striving for self-care, because COVID-19 has said we have to step up to look after our own health, and then a tension with that, with adequate understanding of self-health and also access to care. So you can see at the individual level that people are in this tense moment of wanting to do more, not probably understanding enough about what they have to do, and in some cases not having access to that care. The key issue there would be health literacy issues, particularly within marginalized populations, where we are seeing a bigger impact on COVID-19, and certainly then in the developing world. At the same time, we're seeing an increasing in the gap in affordable healthcare. Those who can afford it get it. Those who aren't getting it. And we've got to be very careful that that gap gets so large that it becomes a chasm that we cannot bridge. And then last but not least, again, unpresented disease. So we're seeing low or no early recognition or intervention, and particularly in diseases of a chronic nature, hypertension, diabetes, even cancer, which could then fuel a tsunami of late stage disease that we just can't manage in the future. I see those as being some of the biggest challenges we're dealing with.
It's interesting you say that, John, because I was just reading an interesting article that talked about the rise of telehealth and access to care. And pharmacy is kind of that immediate access point and first point of contact into the healthcare system. But the majority of people, and this was a US study, but telehealth is increasing, but there's a lot of patients, Medicaid patients, that don't have access for various reasons, whether they don't have internet or that they can't just afford the technology that they can access. So we did a survey, FIP and McCann Health, as you know, and pharmacists are saying that they are having more calls on various things, but chronic disease management, self-care. So right along lines with what you were saying around that whole individual level and the tension between striving for self-care and adequate understanding of self-care and access to care is becoming a real problem.
Yeah, I think telehealth will have a very big role to play in the future. In fact, as we go through this conversation and we start to look at where some of those opportunities are, telehealth certainly is one of those opportunities. I think pharmacy, and in fact all of primary and secondary care could avail themselves of.
Catherine, do you have anything to add or any comments that you want to make? Because this is a really interesting space when we think about kind of what really will be the biggest challenges. And I don't think we know all of the challenges, but any thoughts?
No, we definitely don't, do we, Sandra? I mean, John, you've just outlined it really, really helpfully. I think there's the immediacy, isn't there? The acuteness of the COVID pandemic and the subsequent waves, whichever wave we're in. And then there's all the consequent impact on other health issues, which we're yet to really, truly realise. And I think that's the tip of the iceberg piece, which we've got to keep our professions a bit resilient around. Otherwise, it does feel a little bit too big. We've been really impressed, I have to say, with the examples of innovation and what Sandra and I have called really leaning in we've seen from the profession, whether that's in community pharmacy, but also hospital and clinical biology and emergency situations. And really the way in which regulations, legislations and services have almost been put aside to allow the emergency to be managed in the best possible way. Now, I think as we've had 6 to 7 months of crisis, there's almost like got to be a bit of a longer term view on this. And then that includes how do we keep our workforce enabled and supported and resilient, but also how do we meet all the challenges that you're unfolding in the big onion of healthcare need that you've just presented to us, John. So yes, I think there's a lot here. Pharmacy can really play a part, but we've got to really support those pharmacists to do so.
Yes, absolutely. Absolutely. And, and pharmacy will actually do that, because I think there's a natural evolution that we're already seeing in many of the markets where pharmacy are stepping up to actually take a role in extending that primary care, the intervention, being able to step into a health management role. Of course, and you just said it, Catherine, we need to do more to help pharmacy to get there in more countries.
We do, and I see this as a really good opportunity for organisations like ourselves to work together. Sandra, we've been talking about this for a long time, and we do work together, but now we need to really support the organisations who can lobby for change in health ministry level, but also the individual pharmacists on the front line as well. What do they need? Because the opportunities are there. Yeah,
absolutely.
Yeah,
and you know what, it's the time has come, and Catherine and I have talked about this is kind of the burning platform around the entire healthcare system, not just pharmacy. So now is the time. So John, in light of that, and thank you, that was actually it was a great overview. What do you really feel are the biggest opportunities with the challenges that you just outlined? And knowing, you are a globalist, you are an industry leader, and congratulations on being named Industry Person of the Year this year. So with all of that, and with your broad insight, being a physician, could you tell us what you feel would be the biggest opportunity for pharmacy as we move through this pandemic and post this pandemic?
Yeah, thanks for that call out, Sandra. Look, I think given all of what we've just discussed, I think we're at an important time. We are, as a global population, reimagining all of healthcare, from inventing true breakthroughs in intervention, not only in COVID-19 disease, just as Catherine said, to relaxation of regulations so that we can become more agile and inventive there. Access to care is improving, and there is a massive movement worldwide to ensure that access is improved as we come out of COVID-19. And then where I see pharmacy probably playing an even bigger role is that the where of care has changed. We mentioned telehealth before. We know that patients and consumers and customers are wary of going into some of the more structured clinics, etc., for fear of COVID. They are reaching out to alternative methods of diagnosis and intervention. In some places, for example, in the US, even the car has become aware of care. So the where of care has changed. And here in that change of the where of care, I see the biggest opportunity for pharmacy. It's an elongation or an extension of primary care that enables us to significantly redistribute demand through the health delivery system. This will improve presentation, triage, prevention, early detection and capture, particularly of those non-presenting diseases, as well as providing significant cost savings, because many of those interventions can be effectively administered in pharmacy at a much, much lower cost. And that system, just to get back to telehealth, will be one that could fully exploit the COVID reset shift to telehealth, just as you said. And I think what we'll do is that we'll improve, with a lot of the big technology EOM firms, we'll improve access to kiosks and types of telehealth where people can basically have health triage and intervention on demand. So pharmacy will certainly help us with redistribution of demand and elongate that primary care to overcome many of the problems that I brought up as the challenges to your first question. I think at the same time, because of the nature of pharmacy, its proximity to the community, and it's one with the people kind of aura about it, it can also improve health literacy at the community level. This will enable us to then create citizens as partners in healthcare. That will enable us to boost the opportunity for social contracts And social contracts are really going to be the underpinning of how we can manage pandemics, not only this one, but those in the future as well. And maybe then the last point, coming back to the initial first question, filling the gap mentioned before in a stretched or depleted health system, self-care, vaccines, monitoring of chronic disease, triage and treatment. We can see pharmacy really filling those gaps on a stretched and somewhat recessionary impacted health delivery system.
That's great. And you know what, John, it's one thing that we found, again, with the study that we just did with FIP is that pharmacists are kind of stepping into that. They're kind of finding their feet, and we're getting a lot of, we just did a study across 200 countries, 200 pharmacists across 19 countries. And the majority of them said that they're spending time in their day doing triage, and they feel that screening process and that whole piece really is where they step into and are finding that they can actually add value now. So yes. With that, and with those great thoughts, do you have any other thoughts on what will stop these opportunities from being realized?
I think, look, probably the biggest issue that I think we will probably face is that, many of the health systems today, even in the early parts of the developing world, have been built on a paradigm of structured and fixed healthcare systems of primary, secondary and tertiary care administered through some form of an institution. Even though, over the last decade, we have moved over time to have a more fluid structure and more of a shared care approach, but we really haven't moved fast enough, and certainly not everywhere, to enable that fluidity that would enable a greater access to care for the people of the community. Now, COVID-19 has certainly accelerated this shift, and health consumers, in fact, are driving this change, just as I mentioned in the where of care. And as we all discussed, the explosion in telehealth. But legacy issues, older ways of working, some regulations that are kind of going to get in the way could prevent this essential shift, and therefore would prevent us from reimagining what we've discussed earlier. So I think we have to kind of get out of our way whilst bringing legacy issues of value with us. And so I would call that under a headline of legacy to leverage. And when we bring those systems across that are valuable, but we leverage what we're not using, and pharmacy is certainly one of those, I think we will be in a better place, and those obstacles could be removed. Probably at the individual level, uncertainty in what or who to trust or believe may slow down uptake of some of these novel interventions and procedures. As I said earlier, when we see a decline in health optimism, people tend to go a little bit into their shell, and so anything new may be treated with a bit of skepticism. But I'm a firm believer, as you know, Sandra. I believe in the primacy of science and the expert, and I believe evidence will prevail, and pharmacy will benefit from this as a readily accessible, high authority expert in the community.
That's great, John. It's interesting, and Catherine, you may want to step in here. The whole piece around some of the regulations preventing this essential shift. And that we're seeing some relaxation of regulations, but probably not enough. And I think about the vaccine space, we are seeing some relaxation, so pharmacists can kind of step into that. But yet every day we hear in the news that, in order to get people vaccinated, there's not enough vaccinators out there. So there's a real need for us, as you said, and I love the quote, to get out of our own way. I think that's brilliant. Catherine, any thoughts? Because I know FIP is highly involved in what's happening on a global level, trying to work with policymakers and regulators and associations and different professions to bring that all together to help us move along.
Absolutely, Sandra. And I see that the vaccination is a really good point. We had a presentation last week in our FIP Virtual Congress where the estimations with the workforce that we have now who are vaccinator ready, we would have about 24% of the globe being able to be vaccinated if it remains at that level. So there's definitely got to be a speedy solution to this. And also we just see this with with general practitioners or family doctors not being as accessible at the moment. Pharmacists really need to be empowered and enabled to make changes to the medicines that a patient is prescribed, separate from vaccinations as well. What I really love your sayings, John. Actually, the wear of care is just perfect, and I think the telehealth piece will really help with a lot of things. But then also the ability to call people in for a face-to-face. We're going to have to do this across all the different health professions: pharmacy, medicine, nursing, because that's the gap at the moment. You can see that's where the big unseen, unmet need is emerging, and I think there's something here about pharmacists being regarded not just as an add-on to the other health professions, but regarded as central to all of this at the health ministry and at the regulators' tables will be really key. And Sandra mentioned that, we're interested in this. What we find that works really well is to have an example of a country or an area in a country that has made changes and the positive impact that's had to give to that other country that may be struggling to get their voices heard. The one thing I would say, though, is that, and we've said this time and again, Sandra, pharmacy has remained open in all our communities right from the get-go throughout all of this. And governments that may not have spoken about pharmacy as a key health worker or a key health workforce or a key health profession definitely know they are now. And that unmet support that a pharmacy gives to the community around holding all those medicines as well as access to advice has really come to the fore. So it's been almost like the best, in a terrible way. I don't mean this to sound self-serving, but it's been the best PR approach that pharmacy could have had, that we could have waited for. And my worry here is that when we will miss that opportunity to continue on the crest of that wave, to meet all of the things that you have mentioned, John, which I suppose we'll explore a little bit more as we go on. But I think it's really, really important that we don't lose any of this momentum. And I do see a risk with this because, people will think, oh, the COVID's over now, back to business as usual. But actually, business as usual has changed enormously as well. So that's my reflections back to you, John. I don't know whether you've got anything further on that.
I think they're very accurate. I think, there's a certain amount of force within inertia and a returning force. It's part of this pandemic we're at, where people actually want to go back. They want to go back to what they knew before. And there is a risk that some of these advances could actually be casualty to the cause. So I agree with you. I think there may be some things inherent in the customer consumer population that have already started to see benefit in some of these changes. For example, in China, I think in 2019, there were about 190 million people using telehealth. Today, it's more like 580 million. People. So I think there are some positive forces, and this is what I meant by legacy to leverage. There are some positive forces that will maybe keep some of that momentum up, but we shouldn't sit on our laurels on that. We should make sure that we're vigilant, and as a group of high quality experts in the community, that we're entrepreneurial enough to make those changes and have those changes known and keep them going.
Yeah, perfect. Absolutely. Yeah, we can't relax. We've got to keep leaning in on this, haven't we? It's really important.
That's it. Yes.
And collaboratively leaning in as well. And John, I just want to stay on this question for one more minute, only because there was so much you said in there that really kind of resonated. The move to well care, self-care to well care, where we're focused on people are focused on the safety and the health of their communities. The move towards hyperlocalization of care, where people are kind of sticking pretty close to home, and consumers are sticking pretty close to home. And you talked a lot about that level of uncertainty, but I really do wonder, from your point of view, on the role of patients going in to seek self-care more. If you think that in that whole piece, that there is an opportunity for pharmacy, because we see a shift happening into the OTC space. People don't want to go into their hospitals. You talked about not wanting to go into moving away from fixed healthcare system of primary, secondary, and tertiary care through institutions. Do you have any just preliminary thoughts on how that really will kind of move to the forefront moving forward?
Yeah, look, we're already seeing it, as you know, Sandra, that this kind of self-care or a more appropriate level of participation in your own health management is already well underway. It's been forced by necessity through many of the issues of COVID-19. You can look at the study which we did across Asia in just looking at effectiveness of hand hygiene, for example. 2 years ago, hand hygiene was probably considered something that you do in the bathroom and occasionally, but across Asia today, 75% of people effectively manage hand hygiene and can reiterate the 20 seconds and use of hand sanitizer. So again, as I said, I think there are positive issues that are driving consumers to take up the mantle, be more responsible and accountable for their health. The opportunity that we have, and particularly at pharmacy, is to give them the information which is understandable and actionable in bite-sized pieces from an authoritative resource that will enable them to keep moving forward and not get set back if they think they've done the wrong thing because they've seen something on the news or on YouTube or whatever that challenges what they thought was the correct thing to do. So the primacy of pharmacy as an expert to help health literacy and keep forward movement towards a more participative health citizen as a partner in healthcare cannot be understated. And I see it increasing.
Wonderful, thank you. Catherine, you have a question.
I do indeed, John. And I think this whole myth busting and information giving is a prime example of where pharmacy can help as well. So I'm going to just, for the audience and those who may not know much about McCann Health, McCann Health is noted to be one of the most awarded global healthcare communications networks. And there are some things that I see as very synergistic to our partnerships and working together. Combining science, creative, and strategy, you strive to deliver the best-in-class services to the world's top brands and companies. And Sandra, you and I have always said we're stronger together in our global endeavours. And I know McCann Health spans a range of global practices around consulting, marketing, comms, and specialty practices like pharmacy, care and patient engagement, really complementing FIP work across nations, regions, and globally. So John, how do you feel the work your organisation does globally can specifically help pharmacists as they increase in consumer engagement, self-care, and ensure wellness? Because we're all talking here about better patient health outcomes and population health outcomes. So what specifically do you think McCann could do? And then I'll follow up with how we could do it together, maybe.
Okay. So look, Catherine, as you know, we've been really investing in understanding pharmacy worldwide for probably the last 5 years. And look, what we have seen in any practice of medicine and health is that while the regulations and the framework, culture, creed, even climate are very much impacts on how health is managed around the world, one of the common denominators of success is to really understand practice. And so we've spent quite a few years looking at pharmacy practice in many, many parts of the world and what are the drivers there of both success and change. And then at the core of, and you've just mentioned it, at the core of McCann Health, we have three powers: science, strategy, and creative. And it's the way we bring these together in a unique but powerful storytelling manner that enables us to make complex health management concepts approachable and understandable, but more so actionable, irrespective of the technical capability. So in working with pharmacy, we can build these stories to help their customers take responsibility for their health, work in a cooperative fashion with pharmacy to improve the way in which they manage their health in the future. So it's those three powers that enable us to create tools that, that enable us to do that. And it does it in a four-part way. First of all, you have to get people interested and engaged in the issue of managing their health and confident that they can do that with the expert pharmacy each time they see them. Imparting readily understandable knowledge. The pharmacy, as I said before, is part of the community. Often they understand the community, they know some of the dynamics within that community, so they can tailor their message to make sure that that knowledge is better understood at the customer level. And then improving health literacy, as we go back to question one about what some of the challenges are. If we can improve health literacy by all of what I've just said in answer to this question, we can create positive health management change in the community that will build up from community into nations and into global communities. And then all ships will rise, all boats will rise. So I think, to put it into one line, because of who we are, because of our communication capability, because of our unique footprint and understanding of how practice varies worldwide, we can certainly help pharmacy maximize self-care and improve health experiences in the pharmacy.
So much, John. I think that's super clear. And I think the four levels that you've mentioned pulls together all your responses to the questions we had for you so far. And I do believe that probably the first one, the whole thing about keeping people interested and engaged, getting them in the door to have a conversation about either their symptoms or the medicines they're on, or any worries about the information, really has been stimulated by the COVID experience, and the fact that pharmacy has remained open for business, open for access, open for patient care. So that really is a positive message there. I think the more, Sandra, the more pharmacy is seen as an accessible health advisor, health and medicines access point, I think then you get the patients and the population interested and engaged. I think that's the starting point, really, isn't it?
Absolutely. Absolutely.
It's a great answer, John. And I really love the way you've come back to, improving the health literacy piece. What we've had to do as an organization is to, in this very fluid time of changing evidence, we've had to be quite responsive and on the tips of our toes, which for pharmacy can be very risk averse, and we don't like to get things wrong. So we've been issuing holding statements around things like hydroxychloroquine and around, the emerging evidence on dexamethasone, etc. And giving pharmacists little versions of these that they can use with patients is really important. Because once a patient knows or the public knows they can go to a pharmacy, it's quite interesting the questions they're asking their pharmacists. And that health literacy piece, I think, is more complex than it first seemed. I don't know if you've got any reflections on that.
Well, I think this is a foundational I think opportunity for our partnership, Catherine. When you look at the work that FIP do and you look at how we come to that from a storytelling point of view, and that storytelling is customized to practice and cultures, I think it's a unique partnership that could certainly advance all of the aims that we've been talking about in this fireside chat, and ensure that our pharmacy personnel and our pharmacists have the right tools to move this along and overcome some of those challenges that we mentioned earlier, so that we could reimagine healthcare delivery worldwide.
Yeah, it's very positive, and I thank you very much, John, for keeping us positive in these discussions during quite tough times that we find ourselves in. Sandra, over to you.
Yeah, you know what? This has been great. And the whole piece, again, just to reiterate on health literacy, is so important, with pharmacists being that closest contact point or touch point next to the patient as they come to get their medications. That is absolutely key. So thank you. Those were great points. Just as we get closer to kind of cluing up the interview, I'd just like to get, John, your thoughts on with the pharmacists that are listening to this podcast and this, kind of engaging in these fireside chats with us. Please share your thinking on the top 3 messages for them as they continue to navigate during these difficult times. And as all frontline healthcare professionals, these can be quite challenging, but your thinking would be welcomed for our listeners.
Yeah. So, Sandra, as you know, McCann Health are a big fan of pharmacy, and we do see them in the future playing a much more significant role, as we've just discussed earlier. So, looking at a COVID reset period, people either call it the new normal or the next normal. What would be the 3 points that come to mind that I would have for our pharmacists friends? I think it's, as humanity, we're probably at one of our most teachable moments in healthcare in history. We are reimagining healthcare across the board, and you, the pharmacists, are powerful agents of change in the where of care. And it's the where of care that is going to be the most positive change in how we can reimagine the healthcare delivery system. For all of what we've said before, health literacy, more participative customers in their own self-management, redistribution of demand to ensure that we have a more cost-effective system, and then positive pressures on the policymakers to enable us to engage in the reimagining to the benefit of all of the community. So I would say that, you're agents of change, and I would accept that mantle. Secondly, you can make science and evidence approachable for everyone. And unfortunately, it's not. And sometimes, while we give people information does not equal understanding. So because of the nature of your role in the community, we can actually make evidence more approachable and more actionable for everyone. And that will again improve individual and community health participation. And as I said before, once that happens, all boats rise. And then the last one would be, as we've all been discussing in this fireside chat, the COVID reset really does present many opportunity. So I would ask all of the pharmacists listening today to see themselves as health entrepreneurs. Investigate these changes, whether they be telehealth, whether they be a more participative way of talking with people about managing their health issues, getting on board with vaccination if you can, and just get involved. Be the agents of change that we need, because at this point of time, pharmacy will be one of the drivers of change in this whole reimagination. And I think it's a very exciting future for everyone.
I think that those 3 points, being agents of change, the time is now, you're exactly right. Information does not equal understanding. That actually, if there was any time in history that is even more important with all of the misinformation that's out there, some of the fake news, that kind of stuff that's circulating. You're exactly right. And pharmacists being health entrepreneurs, I love that, but getting involved. And that's one thing that we find across the profession, is that pharmacists tend to be the introverted, tend to be less involved than they should. And now is the time to step up. It's brilliant. Thank you, John. That's wonderful. Catherine, any last thoughts as we conclude this fireside chat? But I think we should kind of put that on a poster, to be honest.
I think it's great, Sandra. Do you know, the thing about our fireside chats is that we could go into a bit of a doom loop when we think about, you know, the health need that's there. But I love these three areas of work, and I do believe that our organisations can work together to get the wear of care out there. Is such a good idea, and pharmacy has really shown that they are the where care happens place. So I don't think there's a big seismic change to make here. It's just about keeping going with what has happened already. John, I really must thank you for this, because I have to say, having some very positive and tangible outcomes from these discussions is exactly what the profession will need. And I know listeners will really have enjoyed what you've said. I'll leave final thanks to Sandra, but on behalf of FIP, I just wanted to say a big thank you for your thoughts and insights today. And we know just how much workload has expanded during these fluid times. We're super grateful to you for making time for us. And as I said at the beginning, this is one of three, a mini triplet series of discussions with two global leaders that will go out on World Pharmacist Day, Friday the 25th of September, because we think it's really, really important that the profession hears from some leaders outside the profession, not just about the challenges ahead, but as I say, John, what you've done is you've really laid out an opportunity roadmap for us, and I think the profession will grab this and feel very heartened on World Pharmacist Day to listen. You are situated between Tamara Rogers, GSK Consumer Health Global Chief Marketing, and Judy Steinmark, who is the CEO of Global Self-Care Federation. So I won't say a rose between two thorns, but you're really one of three experts that we're looking to get our profession feeling supported and mobilized, but also a bit of challenge there. But thank you as well, Sandra. So I'm going to pass to you for the closing remarks today, but that has been a super fireside chat, John. I really thank you.
Thank you, Catherine.
That's brilliant, actually. A rose between two thorns. I think I'll use that in the future, because that's pretty good.
Tricky, but you know.
John, thank you for taking the time, and as always, you know, the focus that McCann Health has put on pharmacy, the reason that I'm here, the reason that I'm a part of your team, and thank you for that as well, is we do see the value in what pharmacy brings. And the evolving role of the pharmacist is going to be key in helping with some of these healthcare issues that have really been accelerated during this pandemic and what's happening. So we do appreciate all of your time this morning, actually. And we do want to thank you again. Are there any parting thoughts that you have? Although you've given us so much, we can't thank you enough.
No, I'm looking forward to working with you all and driving more change. And this is a great partnership for the future. So thank you for the opportunity to fireside chat with you today, Catherine and Sandra.
Thank you.
Thank you. Thanks, John. Take care.
Thank you.